As Adams County grows,
Our plan is to work with community the whole entire way.
so does its diversity. The state demographer has said it's the first Denver metro county where a majority of the population are people of color, specifically with one of the state's largest Hispanic populations.
And what I will say is the pandemic exacerbated what was already here.
Monica Bulig is director of health equity for Adams County's new health department. What was exacerbated, she says, was the disconnect between the public health team and the people they serve. During the pandemic, local groups took it upon themselves to provide access to COVID-19 testing and vaccines. Those are the types of groups, Bulig says, that they're meeting with now to form a community advisory board.
We need to be considering, how do we get information to people who need it? How do we listen to the voices who have traditionally and currently are oftentimes not at the table?
She says a community health assessment last year showed that the biggest issues limiting access to health care are food insecurity, housing instability, and mental health, giving her team of 26 people direction.
And it's also, what are those changes that we need to make as the systems that are serving communities?
She says the next 6 months will be about building community connections and developing what's called a community health implementation plan.
We will have to be learning from all of these community members, going to the trusted sources, learning from them, and then we're going to have to design accordingly.
But she also acknowledges the sheer size of Adams County, which means different solutions for different areas.
Food security would have very different solutions in rural Adams County compared to in Thornton. And we need to recognize that.
So of the 3 counties that split from Tri-County Health, Adams seems to be the only one with a full-fledged team like this. Arapahoe does have a health equity community engagement specialist. Douglas County does not, but in a statement said that services are based on social determinants of health like housing, transportation, and other factors that create barriers to health care, Kyle.
And we knew that this was going to be the result when the counties went their different ways, because Douglas County, which was the first one to pull out, was very vocal that Douglas County did not think that its needs were the same as Adams and Arapahoe County's needs, and they wanted a different type of health department.
And to that point, for Adams County, at least half of their health equity team came from the Tri-County Health Department. So we'll see how that all works out there.
All right. Thank you, Luis.